Hello, this is Dr. Stanley Lang. Welcome to this video, and I'd like to tell you a brief story of two different patients to challenge you to sort of dig deep and discover what you need to find to be able to make the changes in your life that you need to make. Now, the first patient is somebody that's been dealing with a variety of different symptoms that are probably related to gluten sensitivity, gluten inability to digest gluten or handle it well. And he's had this problem for a lot of years. And the second patient is a diabetic who has been diabetic about 15 years and has done a fair job of taking care of it. But in the first patient, I had explained that it was pretty clear to me that his issues were coming from gluten. We'd done a couple of tests that test dietary changes that lent some evidence to that. And he'd actually tried a gluten-free diet for a month, but had not completely been successful in complete elimination of gluten. He had largely improved his diet, but had not made the big 100% shift. The second patient was somebody that had been resigned to being on insulin for the rest of her life. And she'd never heard about a diet that could reverse diabetes. So when I explained to her that that was an option, it was like a light went off in her head, and it was clear that what I had said was a match with what her heart was looking for. And so the concept behind all of this is what we would call a core desire. Now, a lot of people have issues that they want to have better, but the question really comes down to how badly do they want to have them, those issues resolved? And it really depends on how strong the desire is to make the changes that you need to make. And sometimes you have to make some adjustments inside so that the desire actually becomes genuinely stronger. In the first person's case, he did not have a core desire to get completely better because he's been dealing with this problem for years, and I gave him the solution and he didn't follow through. His excuse of why he didn't eat a completely gluten-free diet was, in my judgment, insufficient. It was just an excuse. Now, I didn't give up on him. I challenged him to another month of a gluten-free diet. And if he experiences the benefit of that, he might change in his desires so that he reaches this deep core desire level of intensity. But right now, he doesn't have that kind of a desire, but he might reach that point once he knows what good health feels like. For the second patient, I am quite confident that she's going to come back with a high level of compliance with the dietary strategy that I outlined that will completely reverse her diabetes somewhere between 3 and 6 months from now. And because she wants it badly, I could read it in her body language and in her verbal language that this is something she really badly wants, and she could already see herself doing it. In her mind, it was already a done deal now that she finally had a roadmap. Before, she was like somebody driving around a complicated city with no map and no idea of where to get from here to there. Now she had a certain roadmap, and combined with her desire, she was going to succeed. And that's what it takes to succeed: a certain roadmap and a core desire. If you have those things, you will succeed in making the big changes in your life. And if you don't have the core desire, you won't succeed, but there are ways that you can build that up. If you don't have the certain roadmap, you won't succeed either, no matter how great your desire is, because you'll keep trying stuff that doesn't work. So I encourage you to sort of look inside. How deep are your desires for getting better and staying well? The evidence is in your behavior. But then how clear is your roadmap? Is it a very clear roadmap, or is it all kind of a fuzzy, vague roadmap has been used by most people for decades and it doesn't work. So I encourage you to look at these things in your own life, and whatever it is, the health challenge that has potential to be solved by lifestyle changes, you can succeed. I wish you well. God bless, and have a great day.